PANiCC is, so PANiCC stands for Paediatric Acute Nursing in Critical Care Levels 1 and 2. And I'm going to do a quick run through and we're going to look at just a bit about the course, a bit about us as facilitators. We're going to look at the handbook, the timetable. We're going to talk about technology, ocean to sky. We're going to look at expectations. We're going to look at the library services and the assessment. So when it comes to virtual learning, so you know every single classroom we talk about where the fire exits are, where the toilets are, and I'm hoping you all know where your fire exits are and your toilets are because I can't run through everyone's locations. But in a virtual classroom, I'm going to ask you all to ask yourself these questions. So we want you to get the most of your experiences. So we're going to say, are you sitting comfortably? Is your phone on silent and is Siri turned off? And can you and minimize the distractions, close down any background programs on your laptop, and are you in a quiet space away from distractions? And are you ready to learn? Because that's what we're all here for. So we are going to ask these questions, but it's just a reminder that, you know, we are in an academic setting, an environment, even if it is virtually. So we've already gone through the Slido questions, so it's just to have a reminder that we will be using Slido throughout the course. It won't just be today, and so just have it on a separate device and not on your laptop, because it means that you can see the screen and not have Slido up. So having it on a phone or a tablet will work much better. Okay. So the course. So a lot of you probably heard of the PANiCC course, and that's been running for a few years through STRS, King's Health Partnerships, and the Evelina being part of that. So a few of us got together probably last year to talk about the course and how we're going to take it going forward. And a big thing for us was making it a critical care course, which is how PANiCC became PANiCC. So bit ironic, but we wanted to keep the foundations of what the course was based on. So we wanted to keep PANiCC, but we wanted to make it in critical care. So we're now a critical care course, and it's a level 1 and 2, and we are now officially what was the PICC Society, who recently changed their name to the Paediatric Critical Care Society accredited. So this is an accredited course now. Okay, So yeah, and this course will cover nursing assessments. We're looking at care and interventions, and we're looking at the evidence behind the interventions we do when we're looking after critical care patients. We're going to look at altered pathophysiology, and then we're going to also relate this to our patients, and we're going to, again, it's looking at the research. So this is us. I'm missing one person's picture, but what I'm going to do is I'm going to put this up on Ocean to Sky with a bit about ourselves. So you've got 8 facilitators. There's a lot of us, but there's a lot of you. So what I want to do is I want you to all put names to faces, because you'll see our names on the handbook, you'll see our names on Ocean to Sky, but it's about the faces, so getting to know each other virtually. So I know that Jenna's asked everyone to send in pictures of yourselves as well. So Jenna is one of my colleagues who's been helping us with Ocean to Sky and the bookings and the admin, so you will receive a lot of emails from her. So please, if you could send a photo, then we can put, again, faces to names, and it means that we can kind of build that virtual team. So you've got me, Sarah. I work at the Evelina. I'm the HDU clinical educator. You've got Stacey, who is our lead. Oh, I'm going to let her introduce herself.
I can barely say my title myself, so I don't blame you for that, Sarah. So I'm the nurse lead for the critical care ODM for South Thames Paediatric Network.
We've got Sam, who's not with us today. He is one of the PDNs at King's. We've got Janet, who's also not here with us at the moment, and she's one of the HDU practitioners at Brighton. We've got Matt, who's also not here with us today. He is the lead nurse for education at the Evelina. We've got Jo, who is here with us today, who hasn't got any speakers. She's one of our RMPs for STRS. And we've got Zoe. Zoe, do you want to introduce yourself?
Hi, I'm Zoe. I'm one of the educators on critical care at the Alex in Brighton.
Thanks, Zoe. And we've got Lucy, who is one of the PDNs at King's as well. So we're going to be the people, your go-to people. So if you need anything, and we will be allocating you module tutors linked to your groups, which I'll come into more detail. So the handbook, I'm hoping you've all seen this handbook. You should have had it emailed to you a few weeks ago, and there's a link on Ocean to Sky. All the information is in here about the assessment. It's got all your learning outcomes, it's got what to do if you're having any problems, and it's got all of our contact details. So please, 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 if you need anything, look in here, and then if not, please contact us. Again, all of our emails are on the handbook, they're on Ocean to Sky, so please contact us. So the timetable, we've had to adjust how we're doing timetables. It's not a standard day 1, day 2, day 3, because virtually we know it's really, really difficult to sit on a computer for 7.5 hours and concentrate. So we're trying to make it as interactive as possible. And the best way we thought to do that was through using blocks and cubes, and just trying to give it more task focus, so you're not sitting at home on your laptops listening to our voices. So I'm going to use block 1, because you've only got block 1 at the moment. Block 2 will be released in the next couple of weeks, and obviously we're changing it as we go, so looking at what works well and what doesn't work. So from block 1, there have been changes as well. The most up-to-date version of this is on Ocean to Sky. So what we're going to ask you to do from now is we're going to ask you to engage by doing e-learning, which again can be found on Ocean to Sky. We're going to and then there, so we've got this for this whole month. These are your tasks. So you've got the respiratory e-learning, you've got blood gas e-learning, you've got respiratory interventions e-learning, chest x-ray e-learning. They are all live now. The LTV e-learning, that's going to come in the next couple of weeks. Again, blocks and cubes. We're not expecting you to do it all at once. It is, it's learning throughout the month. There's going to be a videos on bronchiolitis, airway adjuncts might be coming soon, tracheostomy, NIV, and care the complex needs. These are all again coming soon. We're going to ask you to read a guideline. We're going to ask you to write. I've opened a number of forums on Ocean to Sky, and these are all there for you to write, discuss, network. So this is where it might be submit questions. There'll be a forum open. We're going to ask you to listen. So the 2 Ps in a pod bronchiolitis podcast is also on Ocean to Sky as well. And then the question and responses, we're going to make our own podcast in response to your questions which you submit. And then anything which happens live, which will be on the dates that we set for you. So like today, we've got our introduction, which is happening now. Then we're going to ask you to log out and then log back into the A2E webinar. And then we've got our live sim, which will be happening at 12:30. And then same again for the 23rd. We've got 2 sessions, and we'll ask you all to log in and join us. So what kind of tech can we expect? So everything is in one place, Ocean to Sky. We're going to investigate the links and why they weren't working. For today, can you please use the links I sent on the email? We're going to use Teams mostly, but there is one, like today we're using Zoom, and there might be another program we use called WebEx, which is another way of having an interactive virtual classroom. Again, we're literally trying to make it as interactive as possible. We're going to have recorded webinars for you to watch. There'll be web links, podcasts, forums. We're going to be using Slido to ask you questions, and we're going to have recorded simulations, live scenarios. We've had a lot of filming and video fun, so these are what we're going to be providing with you, again, all on Ocean to Sky. So let's have a look on Ocean to Sky. I'm hoping if I click on this, Ocean to Sky will appear and you'll all see it. Oh, can you see Ocean to Sky, or can you still see my presentation? Okay, I will change that. Right, so I'm going to stop sharing, and then I'm going to share my page and show you all Ocean to Sky, because this is the main content of what we're going to want you to see. So this one here now. So I'm hoping you can all see Ocean to Sky now. Yep. Brilliant. So this is going to be your homepage of where everything is. So there's a little bit of a description, all the dates of our live sessions. You've got all of our contact details again. And then here we've got module resources. So we've got the handbook, there's a library services link, there's the Taking Critical Care Online, which I asked you all to do beforehand. So if you've not done that yet, please can you do that today? And then there's your groups. So this is going to be your main groups throughout the course. I split you into 6 groups, and underneath you'll see that there's a discussion forum for each of you. If you go into your discussion forums, so group 1, this is your discussion forum. You've all got 15 minutes after this call or 10 minutes after this one, so please just have a little look at your groups. So group 1, you've got a management of bronchiolitis discussion, you've got a get to know each other, so this is all about you networking, and you've got a simulation discussion, which is for this afternoon. So if you have a look at that after this call, that would be absolutely great. I've now lost my mouse. Oh, it's on that screen, that's why, sorry. Okay, so then going back to Ocean to Sky, this is your module assessment. So on mine, you will see that there's things which are hidden. These are things which we're going to reveal throughout. But there is your practice assessment document. On your practice assessment document, I've changed it slightly. For those who cannot, who want to do a level 1 critical care course, you would just need to fill out the yellow boxes. And for those who want a level 2 critical care course, you need to fill out the yellow and the green. If you're unsure what level you should do, please contact your manager or you can speak to your module tutor. But I'll come into that again a bit later. There's some policies there, and then here's your block. So this is block 1. So then here you'll see is the live links. We're going to again test these, but use the ones from the email. There's block 1, essential learning. So these are your e-learning packages. Then you've got the forums for discussion, and then non-essential learning. So what we've tried to do is we know that there's a lot, and we know that there's a lot going on in your clinical settings. So if you're really struggling with time, we've got essential and non-essential. What we're asking you to do is to prioritize the essential. Please do not ignore the non-essential learning. It's still really important for you to participate in. But if you're really struggling, please just focus on the essential stuff. And then block 2 will all become clear. So this is Ocean to Sky, and this is going to be your platform for everything. And again, the discussion forums, we can respond to it as well. Yeah. I've just stopped sharing. Sorry, Stacey's just coming in. Yep.
Okay, sorry about that. So I just wanted to point out, because I think I'm not as familiar until recently with Ocean Sky as some people. So for me, what I find really helpful is when I come onto Ocean Sky into the course straight away, the things that I look at instantly are these over here on the right hand side. So the latest announcements. So if there's something, say for instance, we've put a e-learning up or something that you've been waiting for, what we'll often do is put that in the announcements. Or if there's a question that's been popping up about the assessments, and it's been popping up quite frequently, then we'll put something in that latest announcement. So it's worth having a look over there as you log in. The other thing I find really helpful, and I didn't see for a while, was this recent activities. So if you, so managing another course, so I run the PICU course as well. And so coming on to see what people have commented on different forums, I found really difficult until I found this recent activity. So once you use recent activity, you can see which activities have been added since you last logged on and which comments have been added to forums since you last logged on. So it's a really nice way to come to the page and see. So rather than seeing everything, see, right, since I was last here, what has happened? And the other thing that we can do, is not visible right now, but when we have when the learning block will go live today. So what we can do is put a blue highlight, what will come down the side of the learning block down here. So that's not going to be as big a deal for you right now, but when we get down to learning blocks that are further on down the line, as you log into the page, you'll find that you're scrolling down quite far to get to the learning block. So if you get used to seeing where that highlight is, then what you can do is just open the page, scroll down really quick until you see that highlighted blue line. And when you see that blue line, you'll know that you're on the current live learning block. That's all, Sarah. Thank you.
Okay, so we're going to go back to the presentation now. So my presentation should become back on the screen. Is that right? Yeah, brilliant. Okay, so we've gone through ocean to sky. So we're going to go about 5 minutes over just on this session, just from the start. So what we are going to ask for you to do is to check the updates, as Stacey was just saying. On your calls, we want you to submit questions, comments on the chat, but also on the discussion forums. Submit questions. We want to know. We don't want you to sit there wondering things. We want you to ask them. And then, because you know how it is with questions, there's always someone else thinking the same question, so we can address it for everybody. Like I said, if you post any questions on the discussion forums, we're going to address it as a whole in like podcasts and on the live events. So really, really important to submit some questions. Discuss the resources given to you in your groups, like you've got your group discussions. We'll set up some forums for you and for you to discuss between you. So for example, bronchiolitis, talk about what you do in your trusts, give examples, compare, and see what you think, and then compare with evidence and research. Like that's what those forums are there for. And yeah, and then questions, answers, and roll with it. So obviously we're going to have technical difficulties. We're going to have situations where things aren't going to run as smoothly as we hope they would, but that's the joys of virtual learning and technology. So we're looking at expectations. So what we want you to do is we want you to engage. We want you to ask questions. We want to hear your voice. This is why we're doing it as a chat and not as a big webinar, because we want you to engage and talk to us. If you're having any issues, please email us and report it. And give us feedback as well. There will be some feedback survey monkeys and things which we're going to set up. So it's really important for you to submit your feedback so we can improve for the following months and network with each other. One of the big things which Stacey said at the start is the variety of places where people have come from. We want you to get to know each other and network between you, and that's what the groups is all about. But you can also use the chat to have a discussion about what you do in your trust. If you've got something to input, put it in the chat and then people can respond to it. Those questions aren't just for us, they're for each other. So read the discussion threads, read the forums, and share whatever you've got. If there's something you think, oh, I've read an article and I really want to share that, email it to us. We can put it on the further reading. That's what it's all about, sharing and networking. So, and that's what we aim to do on this course. And right, so this is going to come into blogging, which I'm going to come and talk about soon. And yeah, get your points across. We want to hear from you. So library services. So on Ocean to Sky, there is a library service e-learning, that gives you information on how to access the King's Library, but for what you need to do for your trusts is find out about your local library services, and if you're linked to any universities. Most trusts, if you're not linked to a university, you will have your own trust library. It's really important that you all get an Athens login. So Opens Athens, you get a free one with your NHS email. So that's really going to help with your literature searches when it comes to assessments. There's the RCN library, and all the links are on the library services. So it comes up with the KHP library services, but then if you scroll down, it will have links to the RCN. It will have links to the NHS evidence search and the e-learning for healthcare. These are all lots of online resources for you. So just quickly, going to go through the assessment. Your portfolio. What we're asking you to do is we're asking you to build a critical care personal portfolio. This is going to consist of a number of tasks which are in your handbook, just to consolidate your learning. Reflective blogs. We're going to ask you to blog throughout. So after today, the module facilitators who are here today are going to write a blog about, and a reflective blog about how we felt the day's gone, and we're going to share that with you, so then you can see how we're going to reflect, and then you can also reflect on how your virtual lessons are going, how you're finding your clinical practice, what I would call a light bulb moment when you go, oh, this is why we do that, and this is why we do this. Write about it and explore it, and that is what the blog's all about. There will be a summative assessment which will also be part of your portfolio, and this is going to be an assessed presentation, and it's your choice. Again, there's more details in the handbook, and we'll have a session on assessments later on, but just so you're aware that in February there will be a presentation day, and this will be looking at case studies. You can present a case presentation or a care improvement strategy, and we're looking at how critical care is in your areas, and looking at reflecting on a particular patient or a particular care intervention, and for you to explore that critically. So, I've already talked about blogging, but so I'm going to move on to the next slide. So we are virtual, so please, we're going to have some technical difficulties. It's inevitable, it's going to happen. So what I'm going to ask again, like if you're having any difficulties logging in like we have had this morning, please email me as soon as you're having a difficulty, because then I can send the links out and try and resolve it as soon as possible. That's why we have that 15-minute time slot, is so that we can address these. And yeah, if there's anything which you're struggling with, if there's any apps or things which you're not quite getting and it's all a bit technical, just let us know and we can talk you through it. And that is what we're here for. We're here to help your course experience. I'm just going to quickly look at Stacey. Have we got more Slido questions, or are we going to save? Yes, we've got one more confidence scale Slido. And if you've got any questions, can you please type them into the chat? And while Stacey shares the final question, I'm going to have a look at the questions from the presentation. And sorry about overrunning. So how confident do you feel in a virtual course after the introduction? Yay, this is what we wanted. Amazing. Much better. I'm glad you're all feeling virtually happy. Again, if anyone has any questions as well, if they want to email me, please feel free.
Has anyone got any more questions? You want to put your hands up and pop the question in the chat? We'll just hang on for maybe 2 more minutes, just in case anyone thinks of something.
And if anyone hasn't got any questions, you can now leave the call. We will be opening up the next call in 5 minutes, but we're not starting until 11 o'clock. So once you call in, we've got a hand up actually.
Melanie.
Yeah.
Melanie, what's your question?
Hi, it's just regarding the PAD. How are we going to achieve those learning outcomes? It's like, are we going to have placements on a ward, or?
So they'll be done in your clinical setting.
Oh, okay.
Yeah, which is why there's the options of having level 1 or level 2. So you can pick the
Okay.
one which is relevant to your clinical setting. If you're unable to complete the level 2 competencies, then you can get a level 1 critical care course.
Okay. All right. Thank you.
All right.
The intention was obviously as things were face to face, the intention was to offer placements in a tertiary critical care centre. But obviously with everything that's happening at the moment, that is really, really difficult to achieve. If things change and we can get to that point, then great. But at the moment, for the foreseeable future, then we're going to need to be focused on achieving those assessments in your local environment. If there are particular things that you're finding hard, please let us know what they are, what specific competencies there are, and we will try and find ways around it in the virtual setting where we can do some, some sort of, maybe not one-to-one, but small group sessions on specific skills.
Okay.
So we can try to adapt to those things, but we need, obviously, we're pulling all of this together as we speak and adapting to it as we speak. So you just have to be a little bit patient with us. But we have got that flexibility where we can respond to those problems if you do have something specific. If 10 of you come to us and say there's this one skill that we're all really struggling with, then we can go, right, what can we do to help you guys achieve this?
Okay, cool. Thank
Just
you.
keep that kinds of communication up with us.
Thank you.
Lauren's asked a question about, will we have a session going over the assessments that we have to submit? And yeah, we will do sessions really focused on the assessment side of the course. And again, if we go over that session and then there's still a lot more questions, then we can add sort of little 15-minute sessions for people to opt in and out of, so we can have more question and answer sessions later on in the course as well. So if you didn't understand your assessment from this introductory session, that's really not a problem at all. We don't expect you to totally pick that up straight away, but please read the module handbook, take that in, and then we will readdress it at a later date.
Yeah, no, you don't have to. If you start off by doing your formative as level 1 and then you realise you can get level 2 signed off by the summative, you can absolutely swap from level 1 to level 2. So if you're, so that's, you can swap but by the summative. If you started on level 1, you can move to level 2.
What I would say is I would push you all. Obviously, it's up to you in your local areas. But if you go through all this work for this course, then I would say if you can in any way do level 2, then try to do it. Because if your career goes in a certain path and you then find that you really need a level 2 course, you don't want to then have to sort of go back to revisit it at a later date. So even if there's a couple of skills where you think, I'm not sure how I'm going to achieve these, we can look at that and we can try to find ways around it. But if you do think, if you're borderline, then I would say really just try to go for the level 2 if you can.
Okay, so we're going to end this meeting now, and then we'll see you in the next call. And I'm ready to go for the A to E assessment in 15 minutes. So I'll see you all in the next room. Oh.